auscultate the patient's bowel sounds in all four quadrants with the diaphragm, listening for any abnormal sounds to see about the movement in the abdomen. The patient's bowel sounds are normal active. Next thing I'm going to do is auscultate the aorta with the bell of the stethoscope, listening for bruits. Patient's negative for any bruits. Next thing I'm going to do is going to auscultate the renal arteries on both sides in the right upper quadrant and the left upper quadrant with the bell as well, listening for bruits. Patient negative for any bruits. Next thing I'm going to do is percuss the abdomen in all four quadrants using this manner. What I should hear is tympany, which is normal for most patients. Patient has tympanic sounds. Next thing I'm going to do is percuss the liver span. I'm going to start from the umbilical area and percuss up, listening for dullness. Most liver spans are between 6 to 12 centimeters. For a female, I'm going to displace the breast, percuss down. So I hear dullness. Hers is about 6 centimeters, which is normal. The next thing I'm going to do is percuss the spleen in the trabeal area. And I'm going to percuss down. Listening for dullness. And this is what testing for splenomegaly. And then I'm going to test the patient to take a deep breath and hold it. And percuss back up. Again, listening to see if I hear any dullness. But I'm hearing tympany, which is normal. All right, next thing I'm going to do is measure the aortic span. First, I'm going to find the pulse that is located here for the aortic span, and then I'm going to kind of palpate deep until I can feel both sides of the abdominal aorta. And usually it's between less than 3 centimeters, and hers is about 2 centimeters, which is normal. Next thing I'm going to do is lightly palpate the abdomen using a circular motion. And here I'm just pushing, assessing for any pain. Do you have any pain?
No.
There's no pain or tenderness noted. Next thing I'm going to do is do a deep palpation, and this time I'm going to ask the patient to bend the knees up. And I'm going to bend both knees up, and I'm going to push it in kind of like a dipping fashion, which allows me to get a little deeper and feel for masses. Do you have any pain?
No.
Perfect. The patient don't have pain, just fine. I'm now going to have the patient sit up, and I'm going to palpate the flank. I'm touching in the back area as well, and I'm pushing. Are you having any pain? Feeling for any masses? All right, patient does not have pain. There's no issue there. I'm going to have the patient lay back down. Now I'm going to palpate the liver edge. And what I'm going to do is put my one hand under the right side of the patient, and I'm going to palpate under the right costal margin. And I can use a hooking motion, and this is to feel the liver edge. And this patient's liver is soft, smooth. Do you have any pain as I'm doing this?
No.
And I'm also using, like I said, that hooking motion. All right. Next thing I'm gonna do is gonna palpate for the spleen. Palpate the spleen, and I'm gonna lift right under the patient's left side. And I'm gonna ask the patient to take a deep breath and hold it as I palpate under that left costal margin. Normally, the spleen is not able to be palpated, which is normal in most people. Next thing I'm going to do is check for rebound tenderness. In this situation, what I'm going to do is push on the patient's belly or in the patient's abdomen. And what I'm testing for here is to see when I push down, the patient should report that there is, if the patient reports that there's pain at withdrawal, that means the patient is positive. If the patient reports that there's more pain when I push, that means the patient is negative. So I'm going to push down now, and I'm going to withdraw slowly. Where do you feel more pain?
When I push down.
Okay, so that means the patient's negative. Next thing I'm going to do is the psoas sign, and I'm going to have you realize that. This is testing for appendicitis, and I'm going to have you try to lift up. Are you having any pain when I'm doing that?
No.
Okay, that helps determine if there's any appendicitis. If there's appendicitis, or if the patient reported pain when I was doing that, then we would look further into further testing for appendicitis. Next, I'm going to do the arbitrator test. Have the patient lift this leg up, and at the hip, I'm going to push inward. Are you feeling any pain?
No.
All right. This is also testing for appendicitis. If the patient reports no pain, then that is normal, and we have to do no further testing. Next, I'm going to check for CV and tenderness. So I'm going to have the patient sit up, turn to the right a little bit so she can see a little better. Here, I'm going to be percussing, hitting my hand with my ulnar and asking the patient if she has any pain. Checking for tenderness, any pain or tenderness.
Yeah.
And I'm doing this in the CVA area. And this is checking for renal colic. If the patient reports no pain or any tenderness, that means the patient is negative for renal colic. Thank you.